Hey guys, welcome to Medifaction. Today we will learn about the anatomy of paranasal air sinuses. The paranasal air sinuses are a group of four paired air-filled spaces that surround the nasal cavity. In this video, we will learn about an introduction about paranasal air sinuses. We will learn in detail about the frontal sinus, maxillary sinus, sphenoidal sinus, ethmoidal sinus, and also some important clinical anatomy related to it. The paranasal air sinus are air-filled spaces present within some bones around the nasal cavities. The sinuses are number 1, frontal sinus, number 2 is maxillary sinus, number 3 is sphenoidal sinus, and the fourth one is the ethmoidal sinus. All of them open into the nasal cavity through its lateral wall. The function of the sinus is to make the skull lighter and also add resonance to the voice. In injections of the sinuses or sinusitis, the voice is altered. The sinuses are rudimentary or even absent at birth. They enlarge rapidly during the ages of 6 to 7 years, that is, time of eruption of permanent teeth and then after puberty. From birth to adult life, the growth of the sinuses is due to enlargement of bones. In old age, it is due to resorption of the surrounding cancellous bone. The anatomy of individual sinuses is important as they are frequently infected. First, let's learn about the frontal sinus. Number 1. The frontal sinus lies in the frontal bone deep to the superciliary arch. It extends upwards above the medial end of the eyebrow and backwards into the medial part of the roof of the orbit. Number 2. It opens into the middle meatus of nose at the anterior end of the hiatus semilunaris either through the infundibulum or through the frontonasal duct. Number 3. The right and left sinuses are usually unequal in size, and rarely one or both may be absent. Their average height, width, and anterior-posterior depth are each about 2.5 cm. The sinuses are better developed in males than in females. Number 4. They are rudimentary or absent at birth. They are well developed between 7 and 8 years of age, but they reach full size only after puberty. The arterial supply related to the frontal sinus is supraorbital artery, whereas the venous drainage related to it is into the supraorbital and superior ophthalmic veins. Lymphatic drainage is to submandibular nodes, and the nerve supply is supraorbital nerve. Maxillary sinus. The maxillary sinus lies in the body of the maxilla and is the largest of all the paranasal sinuses. It is pyramidal in shape with its base directed medially towards the lateral wall of the nose and the apex directed laterally into the zygomatic process of the maxilla. Number 2. It opens into the middle meatus of the nose in the lower part of the hiatus semilunaris. The opening is nearer the roof. Number 3. In an isolated maxilla, the opening or hiatus of the maxillary sinus is large. However, in the intact skull, the size of the opening is reduced to 3 to 4 mm as it is overlapped by the following. A. From above by the uncinate process of the ethmoid and the descending part of the lacrimal bone. B. From below by the inferior nasal concha. C. From behind by the perpendicular plate of the palatine bone. It is further reduced in size by the thick mucosa of nose. Average measurements are: height is 3.5 cm, the width is 2.5 cm, and anterior-posterior depth is 3.5 cm. Its roof is formed by the floor of orbit and is traversed by the infraorbital nerve. The floor is formed by the alveolar process of maxilla and lies about 1 cm below the level of floor of the nose. The level corresponds to the level of lower border of the ala of nose. The floor is marked by several conical elevations produced by the roots of upper molar and premolar teeth. The roots may even penetrate the bony floor to lie beneath the mucous lining. The canine tooth may project into the anterolateral wall. Number 4. The size of sinus is variable. Average measurements are: height is 3.5 cm, width is 2.5 cm, and anteroposterior depth is 3.5 cm. The maxillary sinus is the first paranasal sinus to be developed. The arterial supply related to it is facial artery, infraorbital and greater palatine arteries, venous drainage into the facial vein and the pterygoplexus of veins, lymphatic drainage into the submandibular nodes. Nerve supply is to the posterior superior alveolar nerves from maxillary and anterior and middle superior alveolar nerves from the infraorbital. Next is sphenoidal sinus. Number 1. The right and left sphenoidal sinuses lie within the body of sphenoidal bone. They are separated by a septum. The two sinuses are usually unequal in size. Each sinus opens into the corresponding half of the nasal cavity. Number 2. Each sinus is related superiorly to the optic chiasma and the hypophysis cerebri, and laterally to the internal carotid artery and the cavernous sinus. The arterial supply related to it is posterior ethmoidal and internal carotid arteries, whereas venous drainage into pterygoid venous plexus and cavernous sinus. Lymphatic drainage to the retropharyngeal nodes. Nerve supply: posterior ethmoidal nerve and orbital branches of pterygopalatine ganglion. Next one is ethmoidal sinus. Number 1. Ethmoidal sinuses are numerous small intercommunicating spaces which lie within the labyrinth of the ethmoid bone. They are completed from above by orbital plate of the frontal bone, from behind by sphenoidal conchae, and the orbital and anteriorly by the lacrimal bone. The sinus are divided into anterior, middle, and posterior groups. Number 2. The anterior ethmoidal sinus is made up of 1 to 11 air cells which opens into the anterior part of the hiatus semilunaris of the nose. It is supplied by the anterior ethmoidal nerve and vessels. Its lymphatics drain into the submandibular nodes. Number 3. The middle ethmoidal sinus, consisting of 1 to 7 air cells, opens into the middle meatus of the nose. It is supplied by the anterior ethmoidal nerve and vessels and also the orbital branches of the pterygopalatine ganglion. Lymphatics drain into the submandibular nodes. Number 4. The posterior ethmoidal sinus, consisting of 1 to 7 air cells, opens into the superior meatus of the nose. It is supplied by the posterior ethmoidal nerve and vessels and the orbital branches of the pterygopalatine ganglion. Lymphatics drain into the retropharyngeal nodes. This is the ethmoid sinus with a closer view. Now let's move on to some important clinical anatomy. Number 1. Infection of sinus is known as sinusitis. It causes headache and persistent, thick, purulent discharge from the nose. Diagnosis is assisted by transillumination and radiography. A diseased sinus is opaque in nature. Number 2. The maxillary sinus is most commonly involved. It may be infected from the nose or from a caries tooth. Drainage of the sinus is difficult because its ostium lies at a higher level than its floor. Hence, the sinus is drained surgically by making an artificial opening near the floor in one of the following two ways. First way is antrum puncture, which can be done by breaking the lateral wall of the inferior meatus and pushing in fluid and letting it drain through the natural orifice with head is independent position. B. An opening can be made at the canine fossa through the vestibule of the mouth deep to the upper lip. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.